If you're looking for an awesome product at a great price, be sure to check out the link in the description. Over 100 critically ill and injured children in Gaza harbor hope for urgent medical evacuation to the United Kingdom. This follows a recent government announcement detailing a plan to provide NHS care to those in dire need. The Sunday announcement outlining the evacuation scheme, slated for implementation within weeks, has been met with cautious optimism. While campaigners applaud the initiative, urgent calls for expedited action resonate, highlighting the tragic reality of children succumbing to delays or being forced to seek medical assistance elsewhere. Omar Din, co-founder of Project Pure Hope, PPH, and an NHS primary care executive, paints a stark picture. Children previously listed for evacuation have perished due to bureaucratic slowdowns, emphasizing the critical need for immediate government action. PPH, having privately facilitated the UK transfer of 3 children this year, now serves as a model for the new, taxpayer-funded program. While acknowledging the potential to still save lives, Din expresses regret over the delayed response. The UK's offer of refuge comes amidst a devastating humanitarian crisis in Gaza, where an Israeli blockade has resulted in widespread starvation and famine, claiming over 50,000 Palestinian lives since October 7. The World Health Organization, WHO, estimates a staggering 12,500 Gazan patients require medical evacuation, prompting calls for increased international assistance. The government's decision follows mounting pressure, including a recent legal challenge against the initial refusal to provide medical evacuations and a petition signed by over 100 MPs. Charities anticipate approximately 100 children on their existing lists will be approved for transfer, accompanied by guardians and possibly siblings. PPH has identified 30 to 50 children in urgent need, while Children Not Numbers, CNN, has a list of 60. A wealth of support is available, with healthcare professionals and others ready to donate time and resources. Din highlights the potential for the UK's robust private healthcare system, working in tandem with the NHS, to significantly expand care capacity. Comparing the UK's response to that of European, US, and neighboring countries Egypt, Qatar, and the UAE, which have collectively evacuated over 7,000 patients, according to WHO data, Din advocates for a more proportionally significant contribution from the UK. One harrowing case involved a child suffering from fourth-degree burns over 40% of his body. Due to protracted government discussions, the child was eventually transferred to Italy, a stark illustration of the devastating consequences of delay. A similar situation unfolded with a 1-year-old suffering from a congenital disease, ultimately evacuated to the UAE, highlighting the difficulties and delays in getting these children to safety. The charity emphasizes the established blueprint, resources, and expertise now available to facilitate a rapid and large-scale response. Last month, CNN initiated legal action against the Home Office and Foreign Office, protesting the lack of medical evacuations. A spokesperson for CNN, while welcoming the government's announcement, revealed the deeply disturbing statistic of 71 children under their care who perished due to inadequate treatment, insufficient medicine, and prolonged delays, a situation they have been pleading for resolution since November of last year. This 10-month delay is described as utterly disheartening. The 60 children currently awaiting evacuation have their documentation and medical records ready for final review by Israel's Coordinator of Government Activities in the Territories, COGAT. Médecins Sans Frontières has previously urged the Israeli government to expedite patient departures from Gaza and to be more flexible with COGAT's approval process. CNN confirms readiness to proceed immediately upon receiving government approval. A Foreign Office spokesperson confirms the establishment